We have Senator Murray and Baldwin, Blunt, Rochester, and two people with heartbreaking stories of how the anti-abortion laws have just been terrible for them, and they represent hundreds of thousands, maybe millions, Alexis, of others who have been in also very difficult positions because of this awful, nasty law. So I thank Shanette Williams for coming and Ashley Ortiz for coming. And then, of course, we have Alexis McGill-Johnson, our great leader of Planned Parenthood, and Kimberly McGuire, who's from URGE. So, and I also thank all the advocates who are here today. Thank you for being here and making sure this anniversary is remembered, okay? But particular thanks, again, go to Shanette and Ashley, because what you have gone through and your families have gone through is tragic. Here you are, okay, is just tragic. Some people who've experienced this type of heartbreak would curse the darkness. That's the normal reaction. When something terrible and unfair happens to you, you just get angry and turn inward. But both Shanette and Ashley are lighting a candle in the sense that they are making sure that other people hear their stories so that it's maybe they will understand that we have to change these regressive laws and fight for Roe again. So I thank you for that, because you are lighting a candle, and the scriptures say that's a saint-like thing to do. Okay. Today marks a grim anniversary in America. 3 years since the MAGA justices on the Supreme Court eliminated the protections of Roe in the disastrous, horrible, nasty Dobbs decision. The Dobbs case will go down in history as one of the worst, most harmful, most regressive decisions in modern history. And it's unfortunately had a terrible and wide-ranging effect. 21 states have significantly restricted the right to choose. 14 states have practically total abortion bans. In states like Texas, maternal mortality is spiking, and people are dying. People are dying as a result of the Dobbs decision. Plain and simple. You can't say it, can't gloss that over in any way. Since Dobbs, 1 in 5 people like Shanette's daughter and Amber Thurman, have had to travel great distances across state lines and wait weeks or more just to get the care they need and deserve and used to have before the Dobbs decision. This is abominable. We know that this is what Republicans want, a total ban on abortion. These anti-choice fanatics will stop at nothing. They don't think their work is finished, even after such a horrible and wide-ranging decision as Dobbs. Reproductive freedom is under attack on all sides. Extremists are banning and restricting abortion, criminalizing providers, defunding care, and interfering with life-saving medicines. These attacks are also devastating our economy. With fewer reproductive health care protections, fewer women are participating in the workforce. State-level restrictions on abortion access, combined with the lack of federal protection, cost the economy more than $133 billion nationally. $133 billion. The 16 states with the most restrictive abortion policies were responsible for $64 billion in economic loss. So as bad as the Dobbs decision was, as catastrophic as the impacts have already been, Republicans want to double their efforts on their crusade against access to reproductive health care and the right to choose. Right now, as we speak, Republicans are trying to jam through one of the most extreme, radical provisions in their big, ugly betrayal. 2 nasty provisions: to defund Planned Parenthood and eliminate coverage for comprehensive reproductive care from the ACA marketplace. So they're not just going after Planned Parenthood anymore, which they've done for a while, but they're going way beyond that, going into the ACA and people who have coverage there. So let's call this what it is. It's a Republican backdoor abortion ban done in the reconciliation bill. Under the bill, under the Republicans' bill, if they have their way, nearly 200 Planned Parenthood health centers in 24 states would be at the risk of closing. More than 90% of these closures would be in states where abortion is currently legal. So it'll affect, you say, well, I'm in a state that has protected women's rights. You're not safe. In all, 1 in 4 abortion providers nationwide would be eliminated. So don't try to let the Republicans argue this is about states' rights. It's all about them taking power away from women to make choices about their bodies. Their callousness has no end. While stripping insurance from millions, they're also doggedly fighting to take American rights away, cutting reproductive health care access to millions. I am here to say that Democrats are going to fight like hell to strip these cruel provisions from the Republican bill, including the bird bath, which will be occurring today or tomorrow. And we're putting up a great fight there. We've just won a couple of other issues in the bird bath, like our national lands and the REINS Act. We're going to fight this one hard. And today also, with Senator Baldwin as our lead, we will introduce the Women's Health Protection Act to ensure that health care providers have the statutory right to provide patients abortion services free from bans, free from restrictions. Republicans to their core know how deeply unpopular their actions on abortion are. They know how deeply unpopular abortion bans are. So they're trying to achieve an abortion ban by another name, in another way. We're not going to let them get away with that. Republicans are now trying to pull a fast one on the American people by putting backdoor abortion ban in their big, ugly betrayal. It's an assault on any person or family that thinks the government has no business calling the shots on their health care. It's an assault on women and families that are facing some of the most devastating and life-saving options of their lives. It's an assault on their rights, and it's assault on your rights as well. So let me be clear. Just as we fought back against attacks on abortion before, we will fight these nasty provisions with every fiber in our being. We feel this so passionately, so strongly, that we will not stop until we achieve our goal of giving women the rights to choose. Dobbs have set us back. Senate Democrats will continue to stand together and fight back against Republicans in every single way. Senator Murray.
Mr. Leader, thank you so much for bringing us here today to talk about an issue that impacts every single person in this country. So appreciate your leadership. To my colleagues and all their work and actions, thank you for being here, for what you're doing, for our great advocates every single day, but mostly to Amber and to Ashley for their willingness to share stories that are deeply personal, but are really important for all of us to hear. Thank you for your courage in being here today as well. 3 years in, it's clear that the heartbreak and damage being caused by Republicans' war on abortion is only growing, but so is the public opposition. The outcry is getting louder and louder as more and more people see the full horror of abortion bans in ways they cannot ignore and will never forget. Meanwhile, Republicans aren't just sticking their heads in the sand, they are sticking to the same dangerous agenda that is already denying women health care that they need, pushing maternal and reproductive health care providers out of red states in droves, driving a dangerous spike in pregnancy complications and maternal deaths, and forcing women to stay pregnant regardless of their health or their own wishes. Republicans are doubling down with even more anti-abortion extremism. Trump is undermining emergency abortion care and the basic safety protections for abortion clinic staff and patients. Far-right groups are pushing junk science and trying to rip medication abortion off the shelves nationwide nationwide, and they are finding support among top health officials in this Trump administration. And Republicans are trying to block marketplace insurance from covering abortion care in their big, ugly bill, not to mention, as Senator Schumer said, trying to defund Planned Parenthood, one of the biggest health care providers in the entire country. And let's not forget, Republicans are sneaking fetal personhood language into everything from state laws to Trump's executive orders. We're talking about an ideology so extreme that it would strip pregnant women of their rights and impose a complete and total ban on abortion, IVF, and even some forms of birth control. And they think they can just slip it onto the books without anyone noticing? Not a chance. We are not going to stop calling out these attacks. We're not going to stop pushing to restore and expand abortion access for patients nationwide. We are not going to stop lifting up the voices of women across the country. And we are going to keep a bright and burning spotlight on the harm Republicans are causing with their anti-abortion extremism, which is exactly what I will be doing this afternoon at the Spotlight Forum, joined by many of my colleagues, and I hope to see many of you there. We are in this battle. We are not stopping. Thank you.
Senator Baldwin.
Thank you. I want to say good morning. I want to say thank you to Senator Schumer, our leader, for bringing us together. I also want to really give credit to our champions, including Alexis and Kimberly, for your relentless advocacy, and of course our brave storytellers, Shanette to tell the story of her daughter, and Ashley. Since the day that Roe v. Wade was decided, Republicans have been committed to doing everything they could to overturn it and strip away a woman's right to choose. 3 years ago, we watched that work come to fruition. Many of us up here warned exactly what overturning Roe and 50 years of precedent would mean. Sadly, we were right about the consequences, and they have been nothing short of devastating. I want to tell you about my home state of Wisconsin. When the Dobbs decision came down, women in my state were sent back to live under a criminal abortion ban that was passed before the Civil War. It was passed in the year 1849, just 1 year after Wisconsin became a state. As a consequence of Dobbs, women who wanted to control their bodies had to drive hours out of state, arrange childcare, take time off work, pay for lodging just to access health care. Other pregnant women had enormously harmful outcomes. I remember meeting a woman whose water broke at 17 weeks. And she was sent home from the hospital and didn't receive the care she needed until she faced sepsis and a fever of 102 degrees. That should never be in America. Thankfully, after 15 months with no access, Wisconsin restored access to abortion in 3 counties. That still means that 69 of our counties, there is no access. Instead of listening to the vast majority of American women and Americans and working in good faith to restore Roe, Republicans are doing just the opposite. They're doubling down. Donald Trump is using every power he has to further limit a woman's right to choose, freezing Title X funding for clinics that offer reproductive care, cutting Biden-era emergency abortion protections, pardoning convicted anti-abortion extremists, all while our colleagues here in the Senate are fighting tooth and nail to defund Planned Parenthood, putting access to abortion care once again in jeopardy for millions of women. And let me be clear, when I say our colleagues fighting to defund Planned Parenthood, that is our Republican colleagues who I'm talking about. Put all of these pieces together that I've just listed, and you have a backdoor national abortion ban. Remember, the president, when he was running, said he would not move forward a national abortion ban. But when you put these pieces together, that's what you have. While Republicans inch towards a nationwide abortion ban, Democrats are united in fighting back. Today, alongside my Democratic colleagues, all of them, by the way, I reintroduced the Women's Health Protection Act to restore reproductive freedom for women nationwide. This bill would tell Republicans to butt out of women's health care, ensuring that states can't put up medically unnecessary barriers that infringe on a woman's right to choose. Right now, women's fundamental rights depend upon where they live. And make no mistake, this lies at the feet of Donald Trump and congressional Republicans and no one else. To all the women in America, know that we are not giving up. We will fight day in and day out to restore your right to control your body without any politician, any judge, or government getting in the way. I thank you so much for your continued advocacy, and we'll turn it over to my colleague, Senator Blunt Rochester.
Thank you, Senator Baldwin, and please give her a round of applause for leading this charge. Thank you, Senator. Leader Schumer, my Democratic colleagues, to each of the champions that are in this room, and to our storytellers, it is an honor to be standing with you today. 3 years ago today, the Supreme Court reversed Roe versus Wade and 60 years of precedent. Women went to sleep on June 23rd, 2022, and woke up on June 24th with fewer rights than our mothers and our grandmothers. And that was the result of decades-long efforts by conservative Republicans to take away our reproductive freedoms. They claimed that they wanted to leave access to abortion to the states, but the Trump administration and extremist Republicans across the nation really wanted one thing: a national abortion ban. And in case you haven't noticed it, the pieces of this puzzle have been coming together quietly. But the puzzle is not complete. They froze Title X funding for clinics, fired reproductive health care experts, restricted access to mifepristone. Look, I can't even say it. Say it every day, mifepristone. You did it. Yes. The abortion pill, and so much more. All while this week, they tried to pass a bill that would strip Medicaid from millions of Americans. And let's be clear, Medicaid covers about 40% of the births in this country, which means they're trying to cut off funding for healthy births while limiting healthcare options available to all of us. Because what is abortion care? It is health care. And who will be hurt the most by this effort? Young women, poor women, women in rural areas, and women of color. And I know this intimately because as Senator Baldwin talked about a constituent of hers, I experienced this personally having my daughter-in-law on Christmas morning a few years ago. Her water broke prematurely. We showed up at a hospital and they sent her home without the care that she needed. Because I knew about our maternal mortality crisis, I was like, we're not stopping here. And we took her to another place. She was able to get the care she needed. And a year later, my granddaughter was born because of IVF. So we know this personally. We know this intimately. For Black women and brown women, we also know that we are disproportionately impacted. We have higher maternal mortality rates. We have higher reproductive cancer rates. We have higher rates of preterm births. This is personal. This is personal. And Republicans cannot say that they are the party of freedom and then tell us what to do with our bodies. He can't be the fertilization president, Mr. Trump. But then you want to make it more dangerous for people to have babies. You can't claim you're the party of strong economic growth, but you're cutting Medicaid, food assistance, childcare, making it harder for women to participate in the workforce, all to give tax breaks to people who already have access to all of these things. So today, we want the American people to know that we have not forgotten where we started 3 years ago, and that to our conservative Republicans across the country who are watching, we see you. We see what you're doing. It may be quiet, but we see it. We see what you're doing. We see the puzzle of a national abortion ban that you are assembling, and we're going to do everything in our power, not just to fight now, but we're going to be ready to push the button when it's time to go and restore our freedoms and our rights. So, as Democrats and as advocates, we're about to put the pieces back in the box.
Thank you. And now the most important part of our little press conference here, our two storytellers. First, I'm going to call on Shanette Williams. She's the mother of Amber Thurman, the first woman recorded in Georgia to have died because of a lack of proper abortion care. Shanette?
I have absolute gratitude to each and every one of you on today, and to everyone that has continued to speak my daughter's name even when I didn't know. My family and I thank you. I want you to zoom in on this picture. This is the result of what happened with the overturning of Roe v. Wade. Would I have ever imagined this being my life? Absolutely not. On August the 19th, my family's life changed forever, and there is no turning back to the way it used to be. When I walked into the hospital on August the 19th of 2022, I went as a mother saying, let me get to my baby so I can make sure that she is good and I can bring her home to take care of her. Again, that was not the end result. It was later in 2024, on my daughter's what would have been 30th birthday, I found out from a resilient journalist that what we thought was just a death was indeed a murder. My baby did not just die at the hands of people that said, we take an oath to do no harm. But you, on August the 19th, withheld care from my baby, my family's baby, for 20 long hours. And what was private to myself and my family, it became public. And today I don't stand as a mourning mother. I stand as an angry, frustrated, determined mother. What do I have to do to make America realize that if we continue to allow politics to intertwine with health care, this is the result? It did not take years to strategize for No Kings. It did not take months to strategize for hands off. We don't need to wait any longer. It's time to fight. I have cried my last cry. I've shedded all the tears that I can shed. Now I want results. No, I cannot help my daughter she's gone. Have I accepted it? I can't say truly that I have, but I'm grateful to God, to therapists, to my psychiatrist, to grief counselors that I constantly depend on. But I have got the strength, along with everyone in this room and behind me, to fight this good fight. We cannot allow any more deaths, because that is the result. Let's be real. That is the result if we're stripped of everything. I have a question that no one has yet to answer. Why is abortion such a big deal? Why do you want to strip a woman of her rights? Everybody's doing the same thing I'm doing. We don't know. I wait. What is the problem with me saying that I'm pro-choice? If you choose to be pro-life, fine. But what is wrong with me saying I'm pro-choice? What is wrong with me saying if I want to have an abortion, it's my choice? No one has yet to answer that question for me. And because my daughter is gone, I'm not going to stop until we get what we need. I have dedicated my life to making sure I honor my daughter, I honor my grandson. When I look at him, I can control my emotions. But how do I help him? He was stripped of his very best friend. Everything he knows and loves, it's been turned upside down by strangers that know absolutely nothing about me, knew nothing about my daughter, knew nothing about my family. But still and yet, it's this control and power. And we have to fight this demon in order for other women, other families, other mothers, other children, other men not to feel what my family feels today, ever since August 19th of 2022. So I stand not as a scorned mother, but an angry mother wanting results. And we're going to get them. Thank you.
All of America should hear Shanette's story. Ashley Ortiz has another heart-wrenching story, and I'm, again, so proud of both Shanette and Ashley for coming forward and telling the world how bad these new restrictions are. Ashley.
Good morning. Thank you for being here. My name is Ashley Ortiz, and I'm a physician assistant from Mesa, Arizona. I'm also a mother. I left behind my 10-week-old son in Arizona to come here and speak with you today. This is very important to me, and I'm going to tell you my story as a survivor of the anti-abortion laws that went into effect after the Supreme Court's Dobbs decision. In December of 2023, I was thrilled to be 20 weeks pregnant. My husband and I were at our routine anatomy scan when the scan clearly showed that my cervix had opened and my baby's foot, or the fetus's foot, had protruded. At 20 weeks, the fetus was not yet viable, and I was in preterm labor. The treatment that would typically be used in this scenario should have been simple and actually very low risk of complication. The doctors should have been able to administer medication to help me deliver the non-viable fetus. But because of Arizona's harsh and heartless abortion ban, they were unable to do so. The treatment was illegal. The medication could not be given to me, and I was told that I would have to wait until I became very sick to receive care. I was told that I needed to stay in the hospital and wait until my life was threatened or until the fetal heartbeat stopped. This could take days or weeks. At that point, my water had already broken and the risk of infection was extremely high. While my husband and I waited for the fetus to die or for me to become critically ill, we scheduled a procedure in Nevada for the following week. I lay there in the hospital, imagining the drive or the flight out of state in the midst of labor, terrified that I would deliver him en route. Doctors were finally allowed to administer the medicine I desperately needed when our baby's heart stopped on Christmas Eve of 2023. I delivered him with a combination of relief, sadness, fear, and anger. Because I had been forced to wait so long, the placenta had clotted to my uterine lining, and I was unable to safely deliver it. My blood pressure plummeted, and I was required to go into an emergency surgery at midnight. The surgery took 3 times longer than it typically would have had I received appropriate and timely care. It was traumatic. I was awake during the procedure. It was frightening. It was painful. I still think about how my husband felt waiting 3 times longer than he thought it would take for me to get out of surgery, running through all the scenarios. This process, this whole experience, this trauma was entirely unnecessary. Had Arizona politicians not decided that they knew better than doctors, this would have been preventable. It was terrifying to know that my dying fetus had more rights than I did, and that I might get seriously ill, suffer future infertility, or even die because of this barbaric abortion law. I'm still recovering from this horrific experience. Part of my recovery has been sharing my story. I've been able to advocate for critical abortion rights protections in my state, and that's why I'm here today, to mark the 3rd anniversary of the deadly Dobbs decision, which ripped away our right to safe and legal abortion. Since the Dobbs decision, attacks on reproductive freedom have escalated, from efforts to restrict medication abortion to increased criminalization of pregnancy outcomes to a reduction in protections for life-saving emergency abortion care. Even as we stand here today, Republicans in Congress are working to defund Planned Parenthood and to take away Medicaid from millions of people across the country. Our freedom to make our own decisions about our families is under attack. This work is never done, and I'm grateful to Senator Schumer and members of Congress who are here today to commemorate the devastating loss of rights that resulted from the Dobbs decision. I do not want others to suffer. I do not want others to suffer because of these laws that are stripping women from their ability to make decisions about their reproductive health and the futures of their families. We deserve a future where healthcare decisions are made between patients and doctors, not politicians. A future where every woman has access to the care and respect that she deserves. Thank you again for the opportunity to be here and to share my story and advocate for protections for abortion rights.
A couple of words really stuck in my mind. The whole story did, that Ashley said, but deadly Dobbs decision. The deadly Dobbs decision. Okay, we have 2 great advocates here, Alexis McGill-Johnson from Planned Parenthood and Kimberly Inez McGuire from URGE. I'm going to call them up together, if you guys don't mind, and to speak.
Thank you. Oh, thank you. Thank you, Leader Schumer. Thank you to Senators Murray, Baldwin, and Blunt Rochester for all that you've done to fight this fight with us. Thank you in particular to the storytellers, to Shanette Williams and to Ashley Ortiz for sharing your stories. This cannot be our future state. This is our current reality, but be sure, flying women across the country, putting them in buses across the country to get basic access to health care cannot be our future state. Asking people to go and wait in parking lots for sepsis to set in cannot be our future state. It cannot be the future that we leave to our children, to my daughters, who are 13 and 16 right now. The last 3 years have been incredibly heavy and hard, as 20 states have eliminated all or some access to abortion, creating an abortion access crisis with a patchwork of places where we are free and some places where we aren't. I wake up in New York this morning, I go to see my mom in Georgia later today, and I'm not free in the same way. Pregnant people, some facing immediate danger to their health or lives, have been forced to flee their states and travel hundreds of miles for care that should be available in every community. And because we now live in a nation where basic essential care is off limits, we are learning the horrific consequences of the Dobbs decisions. What we said 3 years ago has proven to be true. The Dobbs decision was only the beginning. In the years since, threats to our freedoms abound in our courts, in Congress, and in the White House. And as we speak, congressional Republicans are using their big, bad betrayal of a bill to pass that backdoor abortion ban to make it harder, if not impossible, for everyone, everywhere, to get limited access to abortion. That bill includes a provision to defund Planned Parenthood, putting nearly 200 health centers at risk of closure. Now, more than 90% of those closures would be in states where abortion is protected and legal. These closures could eliminate 1 out of 4 abortion providers nationwide and threaten to shut down half of all abortion-providing Planned Parenthood health centers. That's the point, right? To cut off access to basic sexual and reproductive health care, like birth control, cancer screenings, STI testing treatment, and more? Is that the intent of these anti-abortion members of Congress? They know exactly what they are doing. They know Medicaid doesn't cover most abortions because of the discriminatory Hyde Amendment. They know that the discriminatory Hyde Amendment, which is a policy abortion access now is working hard to change, they know how unpopular it is to ban abortion, because the vast majority of Americans believe the decision to have an abortion should be left between a patient and their provider. But most importantly, they know, just like we do, that whether or not abortion is legal means little when you can't get one anyway. The harm of the reconciliation bill doesn't stop there. They also snuck in a provision to bar ACA marketplace plans that include abortion coverage from receiving federal subsidies. This means that people won't be able to use the health insurance they pay for to get the care they need. Amid this attack and the dozens that are sure to come, whether that is access to medication abortion or even emergency room doctors' ability to provide abortion care in an emergency, we haven't let up on the fight. Support for reproductive freedom is vast. We are calling on each and every person who believes in a future where we can control our own bodies, our lives, and our futures to make sure their voices are heard. Our voices, when they arise in unison, have power. Use them to protect our health care. Use them to fight for our reproductive freedom. I'm now going to turn it over to my sister warrior, Kimberly. Good night.
Shanette and Ashley, I want to start by honoring your courage and the courage of all those who are right now walking the halls of these House and Senate buildings to tell their abortion stories. Your voices, yes. Your voices are power, and your stories free us from shame. Abortion is safe, abortion is normal, and abortion care should be available to everyone who needs it, period. Leader Schumer, distinguished senators, and Alexis, and my Abortion Access Now comrades, we are here because 3 years ago, the Supreme Court dealt a devastating blow to abortion access in this country, paving the way for half the nation to outlaw abortion care. And where care has been outlawed, those who seek and provide care have become outlaws. Friends have been sued for helping their loved ones get care. Mothers have been arrested and jailed for getting abortion pills for their daughters. And providers have been threatened by states hundreds of miles away for engaging in the simple act of practicing medicine. That the spotlight of the media has moved away to focus on the nation's many other crises does not change the brutal reality that people who need abortion care today are being forced to travel thousands of miles, are suffering, are dying, and we may never know all their names. Young people, people of color, low-income folks have been pushed to the margins with few choices for care. In 2023 in Texas, 18-year-old Nevaeh Crane died after 3 separate visits to the emergency room seeking care. Her providers feared prosecution under the state's abortion bans, creating deadly delays in treatment. Anti-abortion extremists don't want us getting care in hospitals or clinics. They're trying to ban safe and effective abortion pills, and they seek to isolate and punish seekers of abortion and those who offer them support. And history will mark who in this moment stood by in silence and who fought back for dignity, health, and reproductive justice. Abortion bans, like attacks on trans young people and the criminalization of our immigrant familia, they are all part of a broader agenda to control our bodies, strip our freedoms, while failing to address our demands for healthcare and economic security. But young people and people across this country are rising up. We are organizing for abortion access. We are raising money for life-saving abortion funds. We are supporting our local independent abortion clinics. I believe in the power of the people. And I believe in the possibility of change. And so I know the day will come when supporters of abortion access once again hold the power in Washington, D.C. That's right. And on that day, not only will we make abortion legal again in every part of this country, but we will do better than the status quo of Roe. Because remember that before Dobbs, Texas had already outlawed abortion care. Remember that before Dobbs, more than 1,000 state laws had been passed pushing abortion out of reach, and the Hyde Amendment had been denying care for decades. Today, we commit to a future where all people, no matter their age, race, gender, zip code, income, or immigration status, have the freedom to make decisions about our bodies and our lives. A future where no one is criminalized for seeking care, a better life for their family, or for living their truth. This is the future young people deserve. This is the future that Amber and Ashley deserved. This is the future our daughters deserve. And that's the future I'm fighting for. Thank you.
Thank you, Alexis. Thank you, Kimberly. Most of all, thank you to our storytellers. We'll take questions on this subject from the media, if they have any. Okay. These folks are walking the halls all day today and making the case that we need to protect a right to choose, that we need to protect reproductive freedom in every way. Thank you.